This video is going to be all about epidemiology. So let's go ahead and dive right on in. So epidemiology looks at big picture what is going on with certain public health issues. Now, as you can see on this table, which you don't need to memorize, there is a lot of things that epidemiologists look at and study and track, but we are going to be focusing on infectious diseases. So if you look at where the arrow is on this slide, you'll see that epidemiology as a branch is the study of the distribution and determinants of health-related states in specified populations. Now that last part is really important because epidemiology isn't looking at a specific person and how that one person, is their signs and symptoms are presenting, how they're getting treated, things like that. They're looking collectively at the big picture to see how a disease is spreading, if it is only affecting certain populations, maybe why that is. But not only do they do the kind of science data collection aspect of things, but they're also looking at how to present this information to the general public, many of whom don't have science-related diseases. So they have to collect the data and analyze the data, but also present it in such a way that people can understand. So epidemiologists ask a lot of questions, okay? But some of the main ones that they're looking at is going to be, how is the disease transmitted? And this goes back to kind of a term that I'd like you all to know, which is communicable. And if a disease is communicable, that means it can be spread. Okay, now we can further classify a disease as contagious, which means it's easily spread. Okay, so a disease can be communicable and contagious. An example would be like strep throat, right? It's really easy to get strep throat. But a disease like leprosy is communicable, but not contagious. Because in order to get leprosy, it requires a lot of very close contact with somebody that has it. And I mean a very long, prolonged contact. Okay, so it's not easy to get. There are other diseases like Legionnaire's disease that is not communicable. It does not spread from person to person. Okay, so just some ways we can categorize that. So with infectious disease, if the disease is communicable, we want to know, okay, well, how is it transmitted? Okay, and again, what settings are more commonly, are there cases commonly found? And then, of course, what's the incubation period? That we can kind of predict where and how far and wide the disease may have spread. So when it comes to epidemiology, there are two really important measures that we need to understand. The first is incidence, which is the number of new cases, and then there's prevalence, which would be a measure of the total number of cases. So that includes new cases and existing cases. Okay, so think about, maybe pretend you work for a vaccine company. What are you going to be most concerned about? The incidence or prevalence of a disease? Most likely the incidence, right? Because a vaccine is meant to prevent people from getting the disease. So you would want to track the number of new cases because in theory, right, the vaccine will decrease the number of cases of that disease. But if you were looking at maybe treatment options for a disease, or if you were somebody that manufactures a type of treatment, you would be more concerned with prevalence because you would want to take into account those existing cases, right? Because your treatment should be helping decrease the number of existing cases as those patients get healthy. So from an epidemiology standpoint, when do you report incidence versus prevalence? Maybe both, maybe neither. Well, if a disease is acute, that means it comes on quick, but it also goes away quick. You're going to focus on incidence because the disease doesn't stick around long enough to really track the number of existing cases. So with an acute disease, we worry about incidence. But with a chronic disease that's going to last months, years, etc., we are concerned with both incidence and prevalence. All right, so this was just a quick and easy intro video. And the next video, we're going to start looking at some data that epidemiologists will or might collect and present, and talk a little bit more about how we can kind of classify the spread of a disease. All right, y'all, let me know if you have any questions.